Hi, my name is Orchid Macias, and I'm from Bremen University. This is my presentation on Trisomy 21, or Down syndrome. Some basic information about Down syndrome is that it is a genetic disorder. There are 3 copies of chromosome 21. Usually there's only 2 copies of each chromosome, the 23 of them. However, with chromosome 21, there are 3 copies, hence the name trisomy. Now, there are sometimes partial copies of the 3rd chromosome, of chromosome 21, the 3rd one, so don't always expect a full copy. There are 5,000 babies born each year that have trisomy 21, and that's about 1 in 700 births. It is considered one of the most common chromosomal disorders. It was first identified by John Langdon Down in 1866, hence the name Down syndrome. Now, the risk of Down syndrome increases with the advanced maternal age, so it starts at 35 years old and up, and by the time she hits about 45 years old, it's about 1 in 85 births, instead of 1 in 700. And this is also regardless of race or economics. Some telltale signs of Down syndrome is, first off, is the hypotonia. This gives them lots of flexibility, but however decreased muscle strength as well. You also have the upward slant of the eyes and the flattened face and nose. You have a palmar crease, which you see in the right hand picture. It's a horizontal line, and it's called the simian line. So if you have a little newborn and you can't tell whether the baby has Down syndrome or not, check out the hand and see if you could see that single crease that goes right across the hand. They also have a big space in between the first and second toe. They have a smaller head to body ratio as well, the small brachycephalic heads. They are also very prone to medical disorders such as cardiac, congenital heart disease, respiratory with stridor or wheezing, kidneys, UTIs, or thyroid disorders. Some other signs and symptoms for Down syndrome that's really common is their cognitive impairment, such as delayed language and speech, their mild to moderate IQ. They have learning disabilities as well, and sometimes they make some pretty poor judgments. To test for trisomy 21 or Down syndrome, usually you start off with the generic genetic testings out there. You can get this done during the family planning stages of life, but even before you're pregnant. However, once you are pregnant, all pregnant women should go through prenatal screenings for genetic disorders, and this would include getting their paternal age, ultrasound of the nuchal translucency of the nuchal cord, beta HCG levels, and the pregnancy-associated plasma protein alpha, or A. And if all those come back positive, you have an 85% chance of having Down syndrome. So then during the second trimester, you do what's called a quad screen, quote unquote, and that includes a couple of different things. Other than the maternal age, which we kind of already know, advanced maternal age, you do the HCG level, the unconjugated estradiol, and then the alpha-fetoprotein, and then the inhibin levels. Those are positive. That comes back at 80% chance that you might have Down syndrome. So you combine the two, you have the 85% and then the 80%, and that kind of gives you a 95% chance that the fetus that you have does have Down syndrome. Now, when the baby is born, it's very important to do a physical assessment within the first 24 hours of life. Actually, within the first 10 minutes of life. You have to take some labs within the first 24 hours. And this, besides like a CBC and a TSH for thyroid, and a CBC for just regular things, you also want to do some testing for genetic disorders. And a really common chromosomal evaluation is what's called like a FISH study. So it's a fluorescent in situ hybridization study. and this one detects an extra copy of chromosome 21. However, it's not the best. It doesn't detect the translocation copies as well. So don't forget that you do want to double check and verify like what you see compared to what the labs show. At this point, you do want to allow the mother to heal, and then you kind of want to impart the knowledge that the child does have confirmation that the baby does have Down syndrome, and you want to do it in a very, very sensitive manner. It is very life altering for the family. Um, Points that you want to discuss is the hypotonia of the baby, which might cause feeding issues. Um, you also want to point out like the facial appearances that the baby has, as well as some of the physical signs that they might expect in life. So here are some medical problems with Down syndrome, and it kind of affects many, many, many different systems. Um, Starting off with hearing problems, and hearing losses can be up to 75% of all the children. Same thing with otitis media. They might have vision problems, so they might need glasses, and some of them might have cataracts or refractive errors. A lot of them might have obstructive sleep apnea, and this is due to their nasal sinus passageway, and then the same thing with their trachea, and just kind of like how their body is built or developed. About half of them get congenital heart diseases as well. So a lot of times you want to make sure that the child has a healthy heart. Might want to consider doing an EKG at the very beginning as well. They have a lot of GI issues too, and they might have gastrointestinal atresias, which might lead to GERD or failure to thrive. Um, some of them have thyroid disorders, so always double check the thyroid glands. Some of them might have seizures. Hematological problems are very common as well, and some of them might actually have leukemia, so don't forget to do the CBC just so that way you screen up for any type of cancers. And then as you can see, the bottom of the list just kind of goes on. They do have respiratory issues like stridor and wheezing, and this is due to their small tracheal sizes. The small tracheal sizes might also lead to poor inability to actually trach them if they need to, or intubate them. Let's say if they have breathing problems when they're first born. They have feeding issues, like I mentioned earlier, from the hypotonia, which eventually leads to failure to thrive. Now, with the small tracheal sizes and the hypotonia, that does lead to car seat safety issues, because when they're put in the car seat, their head's kind of like bent forward. So a lot of times they have an oxygen desaturation, which might cause apnea or bradycardia. You also want to look for spinal instability for them as well, and you should get them to see a doctor about twice a year for this, for any type of developmental issues. And every year from there on out is very important. As you can see, this is a clinical guideline from the American Academy of Pediatrics, and they have this long list, as you can see, a summary of it, of what you should be looking out for. Let's take, for example, like the first year of life, you have things like going to genetics, make sure you do supportive groups, make sure you do physical exams, eyes for the cardiac, cataracts, and eye visions, make sure you get their hearts checked out, make sure you do the TSH for the thyroid levels, and so on and so forth. So you can see there's quite a number of things that you want to follow up, and you want to make sure that you hit these points so that way you can have successful medical management for the child. The overall management for Down syndrome, there's really no cure for Down syndrome itself. It is a genetic disorder. They're just gonna have it until we could. You can't do genetic manipulation on somebody who's already alive. Anyways, so there is the overall management for trisomy Down syndrome is that the medical management support, like I said, so make sure they're being seen very frequently for their issues. Make sure you follow up on these issues. They see their specialty doctors that they need. So make sure you do your medical management. Early interventions is very, very important. And you can start as early as the genetic testing from even before pregnancy, saying like, hey, this is the most common genetic disorder out there. Here's a little bit about it. These are things that you are to expect from it. And even like when the baby is in utero, maybe when the baby's born, like these are the confirmation tests that are it. So here's some information, here's some pamphlet stuff that you want to look out for. And a lot of it is social and emotional support for the family. Well, I mean, other than the medical management, but you want to give the family a good positive environment so they can give the good positive environment for the child. And the child, somebody with Down syndrome does really great with good support, loving, organized, a positive environment that it just increases their chance of success as they grow up. And this success goals of life can include attending school. Eventually, some of them get work. They create meaningful relationships. They contribute to society. They can even vote. So, and you can see the picture here. The boy has a couple of medals. So they do get they can have a very successful life if they are given the correct opportunities in a good positive upbringing environment. Some anticipatory guidance for somebody with Down syndrome. Make sure you review their developmental progress throughout their life. This includes both medical, social, psychological, behavior functions. Don't forget to add in that family counseling for the family, so that way, just the way to just let things out. For another goal for them is independence and responsibility. So their social skills, as you like encourage these responsibility and independence, they create relationships, help them with self-help and self-care and hygiene. Eventually they might possibly go to a group home or have some independent living opportunities as well. You do want to make sure they have that social support, though, which includes the financial portion of it, and then the health insurance, and even guardianship as they are adults. You want to make sure that they have these things so that way they might not be completely, fully functional independent, but they do get very close to it. However, they still might need a guardianship. The life expectancy for Down syndrome used to be in the 20s back in the 80s, 1980s. However, in today's world, they can live up into the 60s. So hence why it's very important that you're not only looking out for the immediate effects, but also the long-term effects. So teaching them that self-help, independence, responsibility role. And like I mentioned before, a lot of them get jobs. They are very hard-working, dedicated people. They might not be the greatest in flexibility, such as like different work schedules or like quick things that happen to them. But they are very good and hard, dedicated workers. So a lot of times people hire them to things like stocking or like putting things on shelves, maybe cooking or cleaning, things that are very routine. It's very beneficial for them, and it gives them like a sense of wholeness and a responsibility, and kind of feeds back to the community. Um, and so they do have a very happy life. Like I said before, give them a good environment. Make sure you monitor their upbringing and their medical management. Give them a good supportive environment, and they do really well. Anyhow, this is my presentation on Down syndrome, Trisomy 21. A lot of my information comes from the Pediatric American Academy of Pediatrics. There's a journal out there with the clinical guidelines for Down syndrome. Some of my information also comes from the National Down Syndrome Society. That one was really helpful, and same thing with Children's Hospital of Philadelphia. And I appreciate you guys listening to my presentation, and I hope you have a wonderful day. Thank you.